Friends, in this video we are going to watch the divide and conquer technique of phacoemulsification. This is the basic technique of phacoemulsification which every new eye surgeon should learn first. This is the main incision at mid-limbus. It can be on the posterior aspect of the limbus also, but not in the clear cornea. This is a side port on the left side of the main incision. Till nucleus management, we are going to show this video real time. An air bubble has been injected into the anterior chamber, and now this is trypan blue dye being applied over the anterior capsule underneath this air bubble. If you use an air bubble, the dye is not diluted by aqueous and staining is quick. The dye is washed out, and now the antechamber is filled up with a viscoelastic substance. In this case it is 2% hydroxypropyl methyl cellulose. And now you can use a needle, 26 gauge bend needle, or a utrata forceps. If you use a utrata forceps, raise a capsular tag like this and keep the anterior lip of the main wound lifted up so that leakage of visco becomes minimal. And here it is. This is completion of the rhexis. This has been a large rhexis because the nucleus is quite hard in this case. Nuclear sclerosis is about grade 4. This is hydrodissection. You can see the fluid wave. I am operating at a peripheral center where this camera is quite old. Maximum resolution that this camera can offer is 480 megapixels, but the magnification is good for observing the steps. And now the phaco needle is introduced into the anterior chamber. Some superficial cortical lens matter is removed. And now for divide and conquer technique, grooves or trenches are made on the nucleus. At this time a vacuum is low, about 50 to 80 millimeter of mercury. Flow rate is also low. In this case it is 20 millimeter, 20 ml per minute, and ultrasonic energy is according to the hardness of the nucleus. In this case it is 70%. Some air bubble is there, maybe cavitation bubbles. We go to phaco 2 where with high vacuum and high flow and remove the air bubbles. Again I go to sculpt mode, low vacuum, low flow rate and adequate ultrasonic energy. And the key here is you sculpt and go. Don't go without sculpting. And always remember the contour of the posterior surface of the nucleus. It's just like a boat, so when you sculpt you should go deep at the central part, and in the periphery you should gradually come upward. Here at the center should go deep, and this divide and conquer technique should be learned on a nucleus like this, grade 3 plus or grade 4, not less than grade 3. And now see how the nucleus is being divided. Go to the floor of the trenches and apply opposing forces and the nucleus will crack. In this case, we have got 4 free pieces. Now each nuclear piece is tilted and emulsification is started from its apex. Once you start emulsifying from the apex, the chance of catching the posterior capsule is minimal and incidence of posterior capsular rent will be less. And now after cracking, I am in Phaco 2 mode where the vacuum is 400, flow rate is 40 and ultrasonic energy is 70%. And this is the last piece. At this time we can reduce the parameters. We can go to Phaco 3 mode where the vacuum is 300, flow rate is 30 or 25 and ultrasonic energy is about 50%. And now the video is at 150% speed after management of the nucleus. Part of the cortex has been removed by the Phaco probe itself, and this is a 23 gauge Simcoe cannula. The rest of the cortex is being removed by this instrument. We can do a little bit of polishing by the same instrument, or we can use an irrigating probe. Irrigating probe is much safer. Irrigation and aspiration is not that safe. Even in cap back mode, you can catch the posterior capsule and you can cause a PC rent. This is enlargement of the main wound a little bit, and here goes an intraocular lens. Beginners should use viscoelastic substance for implantation of intraocular lens. After doing about 200 or 300 cases, you can try this hydroimplantation. This is a bit of moxifloxacin. The side port is closed by hydrating corneal stroma, and then this is the final lavage of the anterior chamber. The anterior chamber is formed very nicely. The intraocular pressure should be on the higher side. Integrity of all the wounds are checked and the case is concluded. Thank you very much for your attention. Hope this video will help you in learning the divide and conquer technique. I want you to be a good surgeon so that throughout your life you will do good surgeries and give good vision to thousands of patients.